Okay, get my sweater. I bought this new sweater. Macy's is 60% off. Look. All right, we're gonna wait for a few more people to join here. So today we're talking about inside-out cheek sculpting. This beautiful patient. There's the pre. Oh, sorry. There's the pre. I'm backwards because of how it's it. There's the post. Let me step out of the view here. And some of the key here is look at that jawline. You know, look how just a little bit sharper her jawline is. I did buccal fat in her. So, you know, buccal fat, okay. Somebody might say, why would you do buccal fat in a patient like this? You know, she's not the classic buccal fat patient. That's true. But that's why I've kind of developed this inside-out cheek sculpting where if you bite on your cheeks, it lifts here. It lifts this jowl area up a little bit because it has to be pulled in towards the mouth. So that pulls the jowl up slightly. So it's just a technique I've developed where I'm sculpting the cheek from the inside. So look, this jowl, she didn't like that her jawline wasn't sharp, wasn't well defined. So you could, in theory, take a line, cut all the way here, take an ellipse out and pull up, and that would do it. But she would have a scar across her face, right? So that's not a reasonable option. So I was playing a little bit more with this buccal fat stuff, and I'm like, oh man. Also, when I remove this muscle on the inside, it lifts that jowl. So I'm lifting the jowl from the inside out. It's getting great results. In certain patients, I'll sculpt the fat pad. I'll even remove it in some. And then that's the kind of a discussion that the patient and I have before. You know, we kind of tailor make this to get things. I don't know if I turned my microphone on.
Okay, you're good.
So yeah, so that's just a really neat aspect, you know, to this new procedure. Let me slide this way so you guys can see pre-post. And look at her jawline. I mean, that's spectacular. If you look here, you can see a little bit of the buccal fat where I contoured her buccal fat, and then boom, that jawline. I mean, it's subtle. You're not going to be like, oh my God, this woman had plastic surgery, but you're going to be like, damn, she looks good. So inside-out cheek sculpting, that's when I tighten the muscle, the mucosa, and I sculpt the buccal fat pad. So there's three different surgical procedures I do kind of within one. I don't know if there's any questions, please ask them here. Paige can read them to me and I'll go over them. In the meantime, so good. Here's, depending on the patient in the population, I'll add on, this is the Morpheus, which is microneedling with radio frequency. So I've added this on to doing her jawline sculpting with buccal fat. So this was a little bit of a bigger case. This puts in little needles, 24 small needles. The device is plugged into the wall, and we shock the skin. Sounds a little bit crazy. Think saran wrap with a blow dryer, right? So that's the idea. I didn't do it to that degree, but after we take that fat out, after I kind of, what we do is we traumatize that muscle on the neck. We traumatize the dermis of the skin. We get those to scar together to lift. But if there's too much skin, if there's not enough elasticity, then that can it can look a little dimply. So that's what we've added to Morpheus to combine with this procedure. It does really neat things. So that, and how I can adjust it, the needle can go in a certain depth, 1, 2, 3, 4 millimeters, and then I can pick where it adds the heat. So if you want the dermis tightened, you'll go more superficial. If you want the fat to be sculpted a little bit more, I'll send it to the lower levels. If you want it really superficial or resurface for fine wrinkles, we'll put it even more superficial. So it's a nice device in that sense that we add on to the procedure to really contour things. Hold on a second. I was just talking to a patient, you know, why do you need to do so many things? Well, I mean, most people have issues for multiple anatomical abnormalities or you know, aging process. So the skin loses elasticity. The fat is atrophied in certain areas and hypertrophied in other areas. So we need to contour the peaks and valleys to help create these shadows and curves. We need to target the elasticity and collagen of the skin. In all these different devices, you know, these billion-dollar companies make a device, but the device typically only does one of these things. So I need to use different ones to kind of tailor make it, you know. Okay, show me the next one there. All right, good. This is Aerolase. Another great skin tightening device. This is the 1062 nanometer Aerolase to target within the epidermis and dermal layers to, again, kind of shrink wrap those around the mandible. The one thing that people come see me for often, let's see right there. I'm backwards, so yeah. They like the jawline. The jawline lower third is kind of my thing. So if you tighten here a little bit and you tighten here a little bit, that's when you can really get that skin to saddle the mandible. And that's what gives that angle of the jaw. That's what, people like to see a straight line here, a little bit of a shadow. And it's about tightening in these specific areas to allow for this volume redistribution, this tightening around the mandible or tightening around the zygoma, with a little bit of a shallowness in the buccal area, a little bit of a shallowness in the submandibular, kind of submental area. And that allows for these contours, these Photoshop almost like contours. So show me the next one. I think next one we got a little bit of an intraoperative photo or a surgical photo. Great. So this is where I make my line. If you open your mouth and you have a white line there where your teeth meet, that's the line of parakeratosis. Clever name. Parakeratosis is because the mucosa has keratinocytes in it, and if you keep traumatizing them, it creates like essentially a scar line there. So if you have that line, then you probably, I don't want to say you need this, but you could benefit from this type of a procedure to lift that jowl kind of mandibular area. Not that you need to get rid of that mucosa. It's essentially that we can remove that mucosa to allow for a little bit of a lift there. So it's just knowing the give and takes of the face, where we can take things away and where we can't. So like I said, you could cut right around the mid face there and pull the jowl up, but then you would have a horrible scar. So that's not a good spot to take. So that's what I have to say about that. So here's an intraoperative photo. This is a smaller resection. I do take significantly bigger portions of the mucosa in different patients. This patient's pretty young, so we were just doing some sculpting. I have two patient populations, essentially. I have the 20 to 30s, those people look great, got nice skin. They just want a contour shape. They want kind of that filtered look. And then I have the above 30 to 40 to 50 who are typically like the anti-aging, the refreshing, rejuvenating look. So the procedure is different in each kind of subcategory, and then even more different in each patient. So yeah, I think, I can get most people happy, and that's the key, is to make people happy. That's just a little mucosa wedge I took. We use it for fishing, and I'm just kidding. It looks like fishing bait. The little mucosa wedge I took at a patient, take it out. It's about what you would bite on if you're actually biting on your cheeks right now, like suck your cheeks and bite on them a little bit. And that's kind of the sensation I'm trying to get. So inside out cheek sculpting, it's just one of the other ways, one of the other things I can do to really help lift and define that jawline. And for some patients, it's the right procedure. Some patients, it's not, but it is something we have in our armamentarium. Again, sweater, Macy's, 60% off, cost me $12. Not bad. Topo Chico. Questions I'll get to after. I got to run. We have some patients. So if you guys submit them, continue to submit them, and then I'll answer them all afterwards in the YouTube channel. How long we got there? How long we go?
10 minutes.
I think that's adequate. Paige will email this out to everybody who isn't here. I don't know why I'm talking to you because you're not here, but you'll get the video. Everybody who was here, thank you, and cheers.